This medication is prescribed for a range of bacterial infections. It functions by halting the growth of bacteria. It is important to note that this antibiotic only treats bacterial infections and will not be effective for viral infections like the common cold or the flu. It is crucial to use antibiotics only when necessary, as unnecessary use can lead to them being ineffective for future infections. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. When taking Xenleta 600 mg tablet Pleuromutilin derivatives, systemic, make sure to take it by mouth on an empty stomach with a glass of water as directed by your doctor. This is usually done twice daily, 12 hours apart. It's important not to split or crush the tablet before taking it unless your doctor tells you otherwise. The dosage will depend on your medical condition and how you respond to the treatment. It's best to take this antibiotic at the same times every day to get the best effect. Remember to continue taking the medication until the full prescribed amount is finished, even if your symptoms improve before then. If you stop the medication too early, the infection may come back. If your condition lasts or gets worse, be sure to let your doctor know. If you experience nausea, vomiting, or diarrhea while taking Xenleta 600 mg tablet, it's important to inform your doctor or pharmacist. This medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, seek medical help immediately if you experience fast or irregular heartbeat, severe dizziness, fainting, or if you develop diarrhea that doesn't stop, abdominal pain, or blood/mucus in your stool. It's important not to use anti-diarrhea or opioid products if you have these symptoms, as they may make them worse. Prolonged or repeated use of this medication may result in oral thrush or a new yeast infection. If you notice white patches in your mouth, changes in vaginal discharge, or other new symptoms, contact your doctor. While a serious allergic reaction to this drug is rare, seek medical help right away if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist for further advice. Before taking Xenleta 600 mg tablet, make sure to let your doctor know if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor about your medical history, especially if you have any liver problems. Xenleta may affect the rhythm of your heart, causing a condition known as QT prolongation. This can lead to serious symptoms such as fast or irregular heartbeat, severe dizziness, and fainting. The risk of QT prolongation may be increased if you have certain medical conditions or if you are taking other drugs that may cause this condition. It's important to tell your doctor about all the medications you are taking and any existing heart problems. Additionally, low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation, especially if you are using certain drugs or have conditions such as severe sweating, diarrhea, or vomiting. Be sure to discuss with your doctor about using Xenleta safely. This medication may also affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine. If you are planning to have any immunizations or vaccinations, make sure to inform your healthcare professional that you are using Xenleta. If you are an older adult, you may be more sensitive to the side effects of this drug, especially QT prolongation. For women, it's important to let your doctor know if you are pregnant or planning to become pregnant. You should not become pregnant while using Xenleta, as it may harm an unborn baby. Your doctor may order a pregnancy test before you start this medication, and it's important to ask about reliable forms of birth control while using Xenleta and for 2 days after the last dose. If you become pregnant, be sure to talk to your doctor right away about the risks and benefits of this medication. It is unknown whether this drug passes into breast milk, so it's recommended to consult your doctor before breastfeeding while using Xenleta and for 2 days after the last dose. It's important to be aware of the potential drug interactions that may occur with Xenleta 600 mg tablet Pleuromutilin derivatives, systemic. Other medications can affect how Xenleta works in your body. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Certain medications, such as azole antifungals, HIV protease inhibitors, rifamycins, ritonavir, St. John's wort, and drugs used to treat seizures, may affect the removal of lefamulin from your body. This can also be the case with other medications that may affect the heart rhythm, QT prolongation, including artemether/lumefantrine, dasatinib, dronedarone, elaglustat, entrectinib, midostaurin, mobocertinib, pymazide, quetiapine, sequinavir, and tacrolimus. Additionally, Xenleta can slow down the removal of other medications from your body, which may affect how they work. It's important to discuss all potential drug interactions with your healthcare provider. Always follow your doctor's guidance when taking Xenleta and any other medications. If someone has taken too much Xenleta 600 mg tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to act quickly in these situations to ensure the person gets the necessary help. This medication should only be used for the condition it was prescribed for. Do not share it with others or use it for a different infection without consulting your doctor first. If you forget to take a dose of Xenleta 600 mg tablet, you can take it as soon as you remember, as long as it's at least 8 hours before your next scheduled dose. If it's less than 8 hours before your next dose, it's best to just skip the missed dose. Remember to take your next dose at the usual time and do not take a double dose to make up for the missed one. Remember to store Xenleta 600 mg tablet at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to disposing of Xenleta 600 mg tablet, be sure to follow the proper guidelines. Don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to discard the product properly when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.